You're watching Man vs. Prostate, and just wanted to take a quick moment to applaud all the organizers for the International Continence Society meeting that's happening right now this week in Madrid. There's so much to learn from tremendous leaders such as Defender Paul Abrams. Please attend this great lecture on Wednesday. How do mLUTS guide our management of benign prostatic obstruction? This is a great question. And I think we have to first look at who are we? What is mLUTS? How do we think about mLUTS from a community perspective? And how do we manage obstruction? And I think, as always, the leadership and insights and vision of Dr. and Defender Paul Abrams continues to trailblaze and show us the way. So when we think about who are we are defenders of the detruser. We preserve bladder health, we prevent late-stage disease, and we end the polypharmacy epidemic together. And we do this with our cystoscopic swords and our urodynamic shields, and we do it on the battlefield of mLUTS. This is our perspective on mLUTS, where the bladder is our queen, and we do all that we need to protect her. She is at the center, as you can see here, and we protect her from bladder dysfunction and damage. We also recognize the complexity of mLUTS. Yes, we focus on BPH BPO and its major contributions to bladder dysfunction and damage, but we also recognize that there are so many other factors that come into play, such as aging, neurologic dysfunction, pelvic floor dysfunction here on the left, as well as metabolic syndrome, strictures, primary bladder neck obstruction, as well as many other causes such as inflammatory stone, dysplasia, foreign bodies, UTIs, trauma, irritants, allergens, diet, right? Chronic pelvic pain syndrome. So many causes that also contribute to mLUTS here at the bottom, as well as polyuria. And so when we think about that and we put the bladder at the middle of the conversation, we need to make sure that the bladder has a seat at the table of shared decision-making 3.0. 1.0 was between the urologist and the patient. 2.0 is when healthcare systems came in to voice their opinion on what resources we had and what we could be allowed to do. But I think it's really important that as we move into this golden era of bladder diagnostics, that we recognize that the bladder also has to be at the table as an equal partner with equal say in helping to shape surgical choice and management of BPH BPO. Defender Paul Abrams leads us by really being clear about the language we use, which is we fix problems, right? We are solution-finding surgeons. We de-obstruct. Just like for UPJ obstructions, we call it an obstruction. And it guides our minds and our actions and our thoughts to look for surgeries to help fix the problem to preserve kidney function on the left here. Similarly, on the right, we de-obstruct the prostate for BPO, benign prostatic obstruction, to preserve bladder function. Now, you might wonder why Man vs. Prostate and On Crusade, we have taken a terminology synthesis. We've maintained these two acronyms, BPH and BPO, and put them together because even though we do not treat histology, BPH now, for better or worse, has become such a commonplace, universally familiar term for the common man, as well as even for urologists, that we need to now use it because it's optimizing the patient experience because they recognize that term. So at least for Man vs. Prostate at a community level, we bring them together and use them in conjunction. And it reminds us that there are three main drivers of good health policy from a Man vs. Prostate perspective. One is the right dialogue, the right de-obstruction, and the right data. And that's one element I just want to focus on today. When we think about the bladder, the biggest issue we have at the table of shared decision making is no one knows how to speak the language of bladder. And the true interpreter of the needs and wants of the bladder is urodynamics. One of the biggest issues when we come to linguistic determinism, or using the right language to help shape our thoughts, actions, and habits, is that we need to evolve as bladder diagnostics has evolved. When I put this poll on LinkedIn, 94% of you all were ready to maybe evolve forward the language from non-invasive and invasive urodynamics, a very binary classification, to perhaps something more, a little bit different, which would be basic, enhanced, and advanced categorization of urodynamics. And so, in full support and with the utmost respect for the academic definition of urodynamics, we would offer in support as well from a community perspective that urodynamics can be seen as any test that provides qualitative and or quantitative data about bladder health. And as a result, what we saw from a community perspective is that you can categorize urodynamics in these three categories from left to right with a progressive increase in quality and quantity of data, with the advanced category having insights in both the filling phase and the voiding phase. The enhanced category has insights in the filling phase or the voiding phase, but not both. And then basic urodynamics is really the workhorse of what we do every day for our BPH BPO patients. And you can see here diary, IPSS, Uroflow, ultrasound technology, as well as bphtool.com. For us to really uphold our mandates, especially to preserve bladder health, we need a battle plan. And you can see here we break it up into two parts. Part one is a thorough evaluation with the proper counseling, the right triage, as well as a bladder health baseline. And part two is deobstruction, which is a blend of shared decision-making 3.0 and the man versus prostate trifecta, which is considering prostate size, prostate shape, and detrusor function. And as a result, I'll leave you with these thoughts on the triangle of triage, which is that we use basic urodynamics to help trigger a bladder health baseline for patients with bladders which are at risk for damage and destruction. And at a minimum, it involves cystoscopy. We feel that cystoscopy is underutilized, that urologists, we need to trust the truth of trabeculation, cellules, diverticuli, trust the truth of our experience and expertise that we know what a bladder looks like when it's under duress. And these bladder health baselines are like a stethoscope that really allow us to listen to detrusors under duress. And so these are just some thoughts that I wanted to share. Get ready for the ICS in Madrid. Please make that talk by Defender Paul Abrams. He has been able to guide us for so many decades now and shines a light into the future for the management of mLUTS, and we look forward to being there and seeing that. I wish I could be there with you, but I won't be able to. But please report back and let me know where we can incorporate his thoughts and ideas to improve our crusade on the ground level. All right, we'll see you guys on the next one. Take care. Bye.